this set of three muscles collectively called the hamstrings. And if you reach behind your knee, and just go superior and squeeze back and forth, you will be able to feel them. Now, this guy over here on the lateral side is the biceps femoris. You cannot say biceps. It has to say biceps femoris, because there's a biceps right here. On the medial side, we have two muscles together. One is called the semitendinosus, the other is called the semimembranosus. Not covered before, but if I have a wide band of connective tissue, a fancy name for that is an aponeurosis, a very wide band of tissue, and it's wider, so they use the word membrane. So this guy going down the middle is the semitendinosus. This other one deep to it, wider, with a wider band of connective tissue, is the semimembranosus. Okay, so biceps femoris, semitendinosus, semimembranosus. Backing up a little bit, here we have the sartorius. This muscle a little bit inferior that goes underneath it, that's the adductor longus muscle. That's the adductor longus muscle. The next large muscle, this great big one here that hooks up to the adductor tubercle, is the adductor magnus. That great big one. So here we have the adductor longus. I'm skipping this one for a little bit. The next great big one coming down here is the adductor magnus. Backing up into the body cavity, we have a muscle that's in the iliac fossa. The muscle in the iliac fossa is called the iliacus. Medial to it is a large muscle called the psoas major muscle. Now, there is a psoas minor that's above that, so you have to remember it as psoas major. Both of these muscles form a common tendon to the femur, and together it's called the iliacus. Iliopsoas, because that's the iliacus muscle. There's the psoas major muscle, iliopsoas coming together. Practical aspect. A person has a severe abdominal injury. One of the things we want people to do, assuming there's no nerve damage, is to lay them on the back and bend the knees. By bending the knees, it causes these muscles to relax. If the knee is extended, there's tension in the muscle, and there's so much pain down there, it causes extra pain. So if a person has a lower abdominal injury, usually you see them with bent knees. It puts less pressure on the internal organs. But there you have the psoas major, iliacus, iliopsoas. Way up here, just a little bit anterior to these blood vessels, is called the pectineus muscle, as in pectineal line. So the gluteus maximus goes into the gluteal line, the pectineus goes into the pectineal line, and it's that little muscle right here, and it actually goes all the way across there, but that's where you can see it here, the pectineus muscle. Now, here again is the sartorius. As I go posterior, a little bit lower, I'm going to have the adductor longus. This next superficial muscle here is called the gracilis. Underneath the gracilis, over here, is the adductor magnus muscle. I want to back up on the gracilis a little bit, but we're now, not to here, We're now down to some of the major muscles in the leg. This large double muscle is the gastrocnemius. In a couple of weeks, a lot of people will be very familiar with that, with the turkey. There's the major muscle in the turkey leg.
What is it called?
The gastrocnemius. That's the muscle right behind the leg. Now, deep to that, there's a flat muscle called the soleus. So here you have the gastrocnemius, and on either side of the gastrocnemius, this little flat muscle is called the soleus muscle. The last one is this muscle on the tibia and in front, called the tibialis anterior. If you were to put your hand on the tibia, reach over laterally, you'll feel the muscle. As you keep on going and press in, you should feel a pulse. This is useful for feeling a pulse in the lower leg. If you go way down, it's called the pedal pulse. But if you just reach around here, the artery is really pretty close. In some models, they actually show it. There's the tibialis anterior, and there you have the anterior tibial artery. Not important that you know anterior tibial artery. Next semester, yes, but not now. One last aspect, landmark. If we take the sartorius muscle, if we take the adductor longus and the body wall, we're going to have a little triangle. That triangle is called the femoral triangle. So, on this model, here is the sartorius, here is the adductor longus, there is the body wall, there's a little triangle there. What's the big deal? Blood vessels and nerves. And one of the ways we determine a pulse on individuals is feeling for the femoral pulse. Next semester, you worry about which blood vessel is anterior, which is posterior, but there's the nerve. When they want one to take blood, when they want to run a catheter, it's really nice to know, once they take the pulse, should they put the catheter anterior or posterior to where the pulse is. Because if you put it anterior, right into the femoral nerve, which is not a good thing. So here you have a landmark based on three muscles. The muscles of the body wall, the sartorius, the adductor longus. All of this will be covered again next week for the people who couldn't make it. And the second part of the period, once again, I will set up a sample mini practical.